Hello, this is Dr. Farah Sultan from Vitology Wellness, and today I'm going to talk to you about your saliva cortisol test and what it can reveal. So, what is cortisol? It is the stress hormone that is produced in your adrenal gland, which is a walnut-shaped gland above your adrenals. And it is also known as your fight, flight, and fright hormone, which is responsible for helping you deal with stressful situations. An acute stressful situation may be if you were driving down the road and someone suddenly pulled in front of you, your instant reaction would be to push the brake pedal. And then you may notice your heartbeat rapidly go up and you go into a mild anxiety or panic state, and then you're back down to normal. But if this flight fright happens frequently for over a period of time, it's not good for us. So chronic stress is a state in which your body is not able to do the jobs that it normally performs in an efficient manner. In fact, high stress over a long period of time can lead to things like adrenal fatigue, poor sleep, poor sex drive, poor muscle weight, as well as weight gain or inability to gain lean muscle mass. So let me show you how this test is done. First of all, we use a 4-point saliva test to do it rather than a blood test in the morning, because it's going to predict how the saliva cortisol levels are through the day rather than just in the morning, which may not give you the true picture. And so in this example, for example, you see the green, you want to be right in the middle of it. As you can see, this individual has something known as adrenal fatigue. So normally in the morning, your levels should be up here, so you're really jumping out of bed, not hitting the snooze button, and you're bright-eyed and bushy-tailed first thing in the morning. So this person is down here. Now the reason they're down here is because they are lacking something known as the cortisol awakening response. This is the normal response your body has to get you going for the day and set the stage for the rest of the day. When we lack the cortisol awakening response, this is because we haven't been sleeping too well through the night. So in the noon, their levels are okay and 4 p.m., but at night, it seems to be a little bit on the upswing. So this is in the morning, at noon, at 4 o'clock, and at bedtime. So this person did give a history of waking up multiple times at night and then having a hard time falling back to sleep. And when that happens, that is leading to adrenal fatigue, especially first thing in the morning. So what are the strategies that we can do to help this person? So number one is to help boost their energy. We use something known as either adaptogens, which are herbs that have been around for centuries. And what they do is they just help our stress hormone adapt to our stress levels. They neither increase it or decrease it, but adapt to the stress and help hence improve your energy through the day. Also helps your sleep throughout the night, your focus during the day, and even your weight and your sex drive. Now, what are the things we can do to help through the night, help us sleep through the night? If the adaptogens are not enough for someone, for example, like asthmatics who've been on steroids for a long time, or people with rheumatoid who've been on steroids, they can have a suppressed or almost flatline response to their adrenal levels. So in those cases, they may need something stronger, either in the form of glandular extracts of the adrenal, or they may even need a compounded prescription for hydrocortisone. So what are some of the reasons why the shape of this curve may be this way? Number one is lack of sleep itself. Number two is infections, inflammation. Number three is hypoglycemia, very low blood sugar levels. Number four is depression, anxiety, and stressors in our environment. And number five is other hormonal imbalances, including your thyroid and your sex hormones, as well as your sympathetic versus parasympathetic response. So in the next video, we'll be sharing more information on how to better your sleep through some non-pharmacological ways. So for now, this is Dr. Sultan talking about cortisol. If you need your cortisol checked, please visit us on Facebook or visit our clinic website, vitalogywellness.com, or call 205-413-8599. Thank you.